Okay, so let's talk a little bit about dental fear. The problem of fear is, for a dentist, it's one of those things you can't even see the full extent of it because patients that are extremely fearful aren't even in the practice. They don't come. And you get some edges of it when you have the situation where a patient comes and they're in extreme pain, and they're sitting in the chair and they're crying, and you talk to them a little bit more, and the pain is a problem, and it is affecting their life. They can't sleep through it. But that's outside of the office. But when they're coming in, sometimes the tears aren't really from the pain. The pain and the tears are really a combination of them worrying about this huge problem of dental fear. The fear of what's going to happen in the procedure. They can be afraid of the sound of the handpiece. They can be afraid of the sound of things moving inside the mouth. They can be afraid of the needle. They can be afraid of what will happen after they go home. Will the doctor stop when I ask them to? So these are the kind of things that we're dealing with, and you can see that once you've established some trust with patients, they're never leaving you. They know this doctor will never ever betray my trust and make sure that I always feel safe and pain-free. Moving slow, having the hand skills to deliver anesthetic in a way that is not as painful as it should be. And that trust kind of builds up over time, and that's sort of a really gratifying thing. For most of our patients that are really, really, really afraid, the solution is fairly simple. It's oral conscious sedation. And what does that mean? It really means that we're going to give you a little blue pill. We're going to crush it up. We're going to put it underneath your tongue. We're going to give you a little bit of a fluid there, like a little shot to take. And then we're going to get you started by laying you back, turning off the lights inside the room, maybe even giving you a little bit of a sleep mask. And we're just going to tell you, hey, go ahead and just try to go to sleep. Do everything you would do when you are laying down to go to sleep at night. That's what we're going to tell you to do. And then we're going to wait for about an hour. And at that time, I kind of like to say that I can wake you up, I can nudge you and get you to come back awake. And so you need to be responsive to me. But basically that edge, that thing that just makes it so it's really terrible to be in a dental chair, the edge is gone. I am a person that is afraid of heights, and so I know just, if someone describes a tall building to me, or I see people going out onto a balcony on a tall building, I can feel the fear. Well, if I have a drink or something like that, or I'm in an airplane with turbulence, and I have a drink, or someone's just with me, or I'm groggy or something like that, it takes the edge off. This is profoundly even stronger than that. We want that edge to just be gone, and that you're just kind of loosey-goosey and relaxing. You're somewhat aware that you're in a dental office. So we'll get you numb, and once you're numb and we've lowered the inputs around you, whether that be sound and light and that kind of thing, you tend to be less responsive, and you can deal with the procedure. Most patients go in and out of sleep, so because they're going in and out of sleep, they get home after the procedure is done, and they are like, did I get anything done? This is called retrograde amnesia. So you forget that you were even here. And that can be as important as anything. A lot of people are suffering from the effects of the trauma, the exhaustion of being in the practice and clenching up all their muscles. A lot of times I have to tell patients, don't clench up your face, don't clench up your jaws, don't clench up your feet, because you're going to be exhausted at the end of it. And that tends to make it even more difficult to come back because you're tired. You just know this was a whole lot. Well, with sedation, we're not going to go through that. You're going to be relaxed the whole time. You'll go home, you'll take a rest, and then you just sort of feel good about, hey, my dental work was done. That's the beauty of sedation. And I think back to those patients that come in and it's very hard to even talk to me, and they're crying. That's that time where my assistant comes and says, hey, you got a patient in Op3 and she's just so afraid, she's crying. We got to go in there and make sure we're gentle with her. Those are the patients where I have to kind of position my chair even further back so that they know I'm not going to come and touch them. Get permission to do everything that we're going to do. Hey, I'm going to lay you back. Hey, I'm going to look inside your mouth now. Look at things on the big screen TV instead of looking at it in their mouth, and giving them an easy way to start to get into dentistry, because a lot of these patients have these major complicated problems in their mouths because they just cannot bear the fear. So that's what it is. Sedation is the solution to those problems. It is very effective. My patients get this done, they get their work done, and they're out of here. That's the promise of sedation. The other thing is that sedation allows us a little bit more time. We can plan out things, and we can do more of your work. Instead of you having to come back over and over and over again and taking up more time, we can do a lot of it in one sitting. So I invite you to come and have a consultation about sedation, or ask about it in a hygiene check if you're coming to the office anyway. Sedation really allows our patients to get lots and lots of work done. Thank you for listening. My number is 301-485-9672. If you want to text me, call me, whatever. Email is drsaintdc@gmail.com. I look forward to talking to you. Bye.